The spread of deadly superbugs that evade even the most powerful antibiotics is no longer a prediction, but is happening right now across the world, across the globe. Marie Francisco reports.
The World Health Organization, WHO, warns that problems related to bacterial resistance to antibodies are a major threat to public health. In a report issued by the WHO, the abuse of antibiotics is cited as a factor.
It's clear that rates are very high of resistance among bacteria causing many of the most common serious infections, the ones that we see both occurring in the community as well as in hospitals.
The WHO report from Geneva looks at antimicrobial resistance, the ability of bacteria to adapt so that drugs are no longer effective. At the same time, the WHO emphasizes that the problem of bacteria growing resistance to existing treatment is already acute globally.
This is not a regional phenomena. This is not a phenomena occurring in just poor countries or developing countries or in rich countries or developed countries. This is something which is occurring in all countries in the world.
In its first global report on antibiotic resistance, with data from 114 countries, the WHO said superbugs able to evade even the hardest-hitting antibiotics, class of drugs called carbapenems, have now been found in all regions of the world.
What it means is that all of us, so our family members, all of the persons in this room, our friends, when we are most vulnerable and in need of these medicines, there is a chance that they are simply not going to be available and we are not going to be able to have access to effective medical care in a number of instances.
For example, cases of gonorrhea that are untreatable with the latest cephalosporins have been found in Austria, Australia, Canada, France, Japan, Norway, South Africa, Slovenia, Sweden, and the United Kingdom. Urinary tract infections with E. coli bacteria that resist treatment with fluoroquinolone antibiotics make up more than half of cases in many countries.
This is a somewhat grim picture, but I also want to point out that it is not a hopeless picture. And especially we feel it's not hopeless if countries and other stakeholders see this report and respond to this report as a call of action.
The call aims for better prevention, detection, and response systems to address infectious diseases threats, including drug-resistant bugs as they emerge anywhere in the world. The WHO says individual patients can also play a role by not pushing their doctors to prescribe unneeded antibiotics or by finishing all antibiotic prescriptions and never sharing the medications. The WHO advises that better hygiene, access to clean water, infection control in healthcare facilities, and vaccination would help solve the problem. This way, there is less need for antibiotics in the first place. Reporting from the Netherlands, this is Marie Francisco for Eagle News Service.